If you're interested in reversing aging, reversing metabolic disease, and or losing weight, this is the right place to be. These are topics that I am passionate about, and healthgroupcoaching.com is how I disseminate my knowledge one-to-one in a group Zoom setting with clients. I'm Dr. Rawat MD, and allow me to give you a tour of what we are trying to achieve at healthgroupcoaching.com. First, allow me to briefly introduce myself. I'm a physician, family doctor, Indian origin, England trained, Canada based, and at the time of this recording, I'm 46 years old. A few years ago, and this was during COVID times, I found that my weight was increasing. I got COVID for the first time. And when I did my blood tests after this, I found that some of my biomarkers were starting to trend upwards into a category where I did not want them to be. This was worrying for me, particularly because of my genetics. My father was diagnosed with type 2 diabetes at the age of 45, despite being a half marathon runner. I've had several family members who died at the age of 55. My grandfather had a heart attack at 55. My grandmother had a stroke at 55. My uncle died of a heart attack at 55 as well. And I was aware that now that I was in my mid-40s, if I did not look after my health, if I did not prioritize and give time to my health, then I could have a similar kind of trajectory. Thanks to COVID restrictions at the time, and I know many other people have had similar experiences, I had the time to really delve into nutrition and delve into lifestyle and really try to figure out at a root level how to fix these problems and prevent these problems from developing. You'd be surprised, at that point of time I was already a physician with over 25 years of experience, but as physicians, most of the time our job is to diagnose problems and use medication primarily for problems. But here, I was now more interested in preventing the problem one step before medication. What we could do with lifestyle, through exercise, through nutrition, perhaps through supplementation as well, to prevent the onset of disease, how we could optimize our health. So I read several books on the topics. I was influenced by several social media personalities, but there was always some confusion in my mind as to where the truth actually lied. Because as I'm sure you're quite aware, there are a lot of differing opinions on social media and even within the academic space. Even if you look at the professors at Harvard University, for example, Professor David Ludwig is a leader in the low-carb space, while Professor Walter Willett is a professor in the whole food plant-based space. So I can see why laypersons get so confused with all these conflicting messages on social media, when even experienced physicians like me find it difficult to decide where the truth actually lies. As a result, I decided to enroll onto a nutrition certification course at Harvard. I had the experience to get education from the likes of Dr. Beth Freites, who at the time of this recording is also the president of the American College of Lifestyle Medicine. I was greatly influenced by Dr. Beth Freites and other coaches on that program, and eventually I formulated my own lifestyle and diet plan. I call this the Set Point Reset Lifestyle and Diet Program. When it comes to weight loss, I realized that modulating our hormones is the most important aspect of not just losing weight, but also maintaining the weight loss. We need to lose weight through a pull mechanism, not a push mechanism. By doing simple calorie counting and cardio, so essentially just shifting the energy balance, calories in, calories out equation, that certainly leads to weight loss in the short term. However, if we do not change the hormonal milieu inside the body, If we don't change the thermostat, which is the set point within the hypothalamus of our brain doesn't want our body to be at a lower weight, then we will not be able to maintain that. We will get metabolic adaptations, our metabolism will slow down, we will burn less calories at rest, and eventually we will gain the weight back. But this is why most crash diets have a 95% failure rate, because if you do not change the hormonal thermostat, you will not be able to maintain that lower weight. And that is done by modulating various aspects of diet and lifestyle, which I talk about on the coaching program. With respect to slowing down aging, the most important aspect is to reduce chronic systemic inflammation. Now, there are many people out there with various types of so-called anti-aging hacks using machines and implements and all kinds of unscientific methods. Most of these people have some data within a lab rat or mouse model or something on those lines. But essentially what happens in our body is as we get older, the amount of chronic systemic inflammation in our body goes up. This is a known fact. When I do physicals on my clients, I often measure their inflammatory markers, including CRP or C-reactive protein. It is recommended that you should have a CRP below 2.0 in order to have low levels of chronic systemic inflammation. Of course, they should be measured at a time when you're not suffering from any acute inflammatory process, such as recovering from an injury or an infection of some kind. Also, you need to rule out chronic infections and chronic autoimmune conditions as well as a potential source of raised inflammatory markers. As we get older, naturally, the CRP does go up, and in fact, I do not check CRP levels in clients above the age of 60 because it doesn't really add very much, as the inflammatory markers are almost in all cases increased beyond the age of 60. So in my mind, the level of chronic systemic inflammation is the best marker for your speed of aging. I focus a lot of my research and a lot of my coaching program on how to reduce inflammation in your body, how to follow an anti-inflammatory lifestyle and diet program. And I'm glad to say that at the age of 46, I had a CRP level of 0. If you see the blood result, it is reported as less than 0.5, which means no detectable inflammation at the age of 46, which I would add is rather rare. Using my set point reset diet program, I was also able to lose 12 kilograms, which is over 26 pounds in weight, in a period of 12 weeks. And I guide my clients on how they can do the same as well. Plus, many of my clients have also noticed a reduction in chronic systemic inflammation and a reduction in their CRP levels as they start following this diet and lifestyle program, which means that they are slowing down the aging process. While on the topic of aging, I do have one session out of 8 which is dedicated on reversal of skin aging. This is another topic that I am passionate about. We want to be healthy from the inside but also appear healthy optimally from the outside. And so I do talk on that program about collagen extracts, hyaluronic acid, retinoids, etc., and other ways of slowing down skin aging. The third pillar of our program is reversal of disease. Specifically, I coach about the reversal of 5 conditions through lifestyle and diet, and these are metabolic syndrome, fatty liver, prediabetes, prehypertension, and PCOD. For many of these conditions, supplements can also be useful. As an example, omega-3 fatty acids, and I do recommend certain brands and formulations of supplements, which is information that I do provide to my participants as well. I find it quite amazing that there are so many clients who get through their life journeys suffering from chronic metabolic disease, and often succumbing or dying due to chronic metabolic disease, that were never educated or even made aware of lifestyle, dietary, and in some cases supplemental changes they could have made to alter their health outcomes. And I'm on a mission to educate as many people as possible. The course is divided into 8 chapters. In the first chapter, I coach you on the causes of metabolic disease. In particular, we talk about the personal fat threshold, we talk about the thrifty genotype hypothesis, and why metabolic disease occurs at a varying range of body mass indexes. We also talk about methods of reversing metabolic disease. We also talk about specific environmental lifestyle triggers which promote metabolic disease and how we can reduce, minimize, and eliminate these triggers. In our second coaching session, we talk about early time restricted feeding, which is a mild form of intermittent fasting, focusing, however, on eating and not eating in line with our hormonal signals. So this is primarily based upon eating early and not eating late, at least 5 to 6 days a week. Reducing weight, reversing metabolic disease, and reducing inflammation often requires some degree of change and some degree of restriction. And one of the most effective science-based approaches to do this is also described as chrononutrition. So eating more in a pattern which is in line with your activity levels and also in line with your hormonal levels. This is also called circadian fasting. In our third coaching session, we talk about a whole food, hyper nutritious diet, not focusing so much on what not to eat, but rather on what you should be eating. Those foods which are the most nourishing, the ones which have the most phytonutrients, antioxidants, flavonoids, vitamins, minerals, which will increase the enzymatic processes of your body, which will boost your metabolism and will be the most nourishing for your body. Because ultimately, we need to aim for a situation where we have more nourishment and less empty calories going into the system. In the fourth session, we talk about specific steps to reverse 5 particular metabolic conditions. So we talk about metabolic syndrome, pre-diabetes, fatty liver, pre-hypertension, and PCOD. In this section, I also give recommendation on certain supplements which may also be helpful in these conditions. Session number 5 is all about the gut microbiome. This is the over 100 trillion bacteria which live within our gut and have a profound effect on our metabolism. If we can modulate our gut microbiome in a positive way, we can increase the amount of positive hormones that our body produces, including GLP-1, peptide YY, etc. And this is how we will produce that hormonal milieu within our body, which will make our body want to stay at a lower weight. This is one of the various methods of how we adjust our set weight point. Resetting the gut microbiome is also instrumental in reducing inflammation within our body. And we have the 6th lecture in which we talk more specifically about causes of chronic systemic inflammation and techniques of how to reduce chronic systemic inflammation, which is instrumental in slowing down the aging process. Lecture number 7 is all about how to manage stress, inadequate sleep, and how to exercise. And this lecture is all about techniques such as breathing exercises, meditation, journaling, resistance training, aerobic exercises, sleep hygiene, etc., and how you can have a lifestyle prescription which is most optimal for you to live that healthy life. And the final 8th section is about how we can reverse signs of skin aging and maintain skin which appears younger than your age. Here we talk about collagen, hyaluronic acid, retinols, glycolic acid, various types of methods of maintaining your skin. And this is another topic that I am passionate about, and you will see more videos on my YouTube channel on this topic as well. Typically, each session consists of a 30 to 40 minute lecture followed by a 30 to 60 minute Q&A session where members ask me questions one by one and I answer these questions in a group video Zoom setting. The course at healthgroupcoaching.com is your opportunity to interact with me one-to-one over 8 Zoom sessions which are held over 4 weeks on Tuesdays and Thursdays at 8:30 p.m. Eastern Time. But if you do not wish to subscribe to a program like that, you can simply subscribe to my YouTube channel where for free you will be getting a lot of information. I have done several videos specifically on the reversal of metabolic disease. Some of these videos are over 30 minutes long, and if it is just knowledge and information that you require, then you can simply watch my YouTube videos. I am converting a lot of these into blog posts on my website as well. So you could just read this information and watch that information for free, and there would be no cost to you at all. My prime motive here is to spread knowledge and spread awareness of ways in which you can alter your aging, any metabolic diseases you may succumb to, and also to help you lose weight. And all of this information is available free of cost to you. But if you would like to have that motivation that you can get from being part of a group session, the motivation you would get by interacting with me one-to-one on Zoom in a group setting, and also one perk of being a paying member on the website healthgroupcoaching.com is that we also form a Facebook group, which is a private group. And so if you would like all of that motivation to help you through your journey, then you're more than welcome to come along. The batches are organized in format of months. So as an example, we completed an April batch just last month. Now we have a gap this month, and we will have a June batch starting next month. Once you subscribe on the channel, the first thing that will happen is you will receive an introductory email. You will then receive a 15-page lifestyle, diet and nutrition prescription from me. And closer to the dates when the program begins, you will receive a Google Calendar which you should subscribe to, which will also include Zoom links for entry into the Zoom classroom. Of course, if you're unsure about joining, you're not sure exactly what it entails, then you can always click on the contact button at the bottom and email us. One of the most common questions I get is, what if I can't attend every session? Well, I do provide recordings of the sessions after the session, but it would be better if you are available at 8:30 p.m. on Tuesdays and Thursdays Eastern Time, because the recordings more or less you could get for free. There is a free subscription option as well on the website, and people who are subscribed to the free subscription get recordings posted to them. The real benefit of joining as a paid member is being able to attend the sessions in person, which is typically about a 30-minute coaching session followed by a 30 to 60-minute question and answer session. So being able to ask those questions which are more personal to yourself is a real benefit of joining in, plus having 24 hours access to the Facebook private group where you can put questions, post pictures, and I will be able to respond directly to you any time of the day on that Facebook group as well. Those are the main two benefits of taking a paid membership over a free membership. Once you have been a premier member for 1 month and are part of that Facebook private group, you're actually a member there for life. So that's another benefit of taking that subscription for 1 month. Also, you could always downgrade your membership to a free membership after that first month, and that way For free, you would be able to get recordings of all sessions without having to pay anything at all. You still maintain your membership as part of our community. You still stay on my email list, and you will be the first people to find out when I create more course material, whether it is my lifestyle prescriptions or videos, or in fact the book that I'm writing, which is titled Slow Aging, Reverse Disease and Lose Weight. So if you're ready to embark on a 4-week journey to slow down aging, reverse disease and lose weight, then click on the subscribe button. At the minimum, take a free membership and subscribe on the YouTube channel so you'll keep up to date with all the information on achieving your health goals. Take care everyone. I'll see you at the next video.